Welcome to another episode of It's All Mental. My name is Asiat, and here we bring you conversations that have to do with our health, our mental health, and everything that is concerned with some of the challenges that we face on a daily, our family members, as well as our friends and the community around us. With me here today is Dr. Peter, who is a public health specialist, and he's going to tell us more about the things that they are doing in terms of research, because he's a researcher at the Hutch Institute, working hand in hand with Uganda Cancer Institute. And we want to know about most of the things that they are doing in regards to research that they are doing quite there. So, Mr. Peter, could you tell us a little bit about yourself to someone who is watching us or who watched our previous episode?
Yeah, once again, I'm Peter. I'm a public health specialist and a psycho-oncologist at Uganda Cancer Institute, and I'm involved in research, especially in cancer, and done several research, especially in different cancers. I can talk maybe specifically about Kaposi sarcoma, because that's where I've been doing most of the research. And right from the time of screening, when people come and they don't know what their diagnosis is. So out of this research, we've been able to support people to ensure that they get diagnosis done, and something that would cost maybe 200 or 300 or 500 outside there, we do it for free at through the research department, and we're able to take off a biopsy for this patient, and they're able to take it to Cancer Institute, and it's also done free. So meaning the burden that a patient would have of going and moving around different places is done what?
Taken care of.
It's taken care of, it's addressed out of the research that we are doing. Then you're also able to offer them with psychosocial support for some of these patients. We talk to them what they should expect about the side effects of the treatment that they'll be getting, how to go about them, what to do, and we also encourage them to call us because of anything that we are open to communicate with them and support them in the best way possible. So research has really been helpful, because we do research in different cancers, breast cancer, cervical cancer, and we're reaching an extent where we're going into clinical trials as well into the area of cancer. All this is aimed at improving the care of cancer patients, because we don't do research, they will not improve, will not know where we are going and where we are coming from. So research it is a key area that needs to be emphasized and carried out in the area of cancer.
Okay, what new discoveries has this research been able to inform the people that are the oncologists that are right now improving upon the care that they give to their patients?
Yeah, there's some research that have especially, there's one that carried out about looking at fevers among cancer patients, and it was able to know that there are those patients who have resistance to antibiotics. So out of that, the medical team I formed to know that this one has this kind of resistance to this kind of medication. So they are not given that medication. So they are able to give them the right antibiotics that help these patients to improve their lives, and then they get well.
Okay. In regards to your partnership with Hutch, right?
Yes.
What are some of the things, the new innovations that you feel like Hutch was able to introduce more at Uganda Cancer Institute?
So one of the things is partnership. Hutch and Cancer Institute is the building. There's a building there that is used to see patients, outpatients, and it hosts even the PAD team. Children are there, they're seeing from there. So even that building itself, when someone enters and they're able to access the different facilities, there are toilets there. So there are medical team there to see them. There's security. That's another thing, because we don't take it for granted. People have lost items as they come for care, find someone's bag is carried, the one is taken. So through that partnership, this building it is very helpful. Their clinics that run on a daily from Monday to Friday in that building. Out of that partnership, yes, they're able to see doctors, see patients, even medical doctors have been trained and have been supported out of that collaboration.
Okay, Mr. Peter, you've also, in our previous conversation, you've talked about the National Cancer Control Program strategy. Could you elaborate to someone who doesn't know about it more for us to get to understand what is it more about?
So the National Cancer Control Plan is about the strategy that the Ministry of Health has come up with to ensure that they support these cancer patients right from the community, where they do outreach programs, they screen patients. There's a van, there's a bus that has almost all the required items that they need to use. So when they go, they conduct screening in different areas around the country. So through that screening, they're able to know which patient or which person may be having cancer. In case they doesn't have cancer, they come and do other investigations to rule out. And I think this could be even the reason why I have so many maybe when so many patients coming out because of the sensitization that's being done in the community in different parts of the country. So it is really something that is really good, and I pray that we even get more buses, so that we're able to move different directions. There are even places that are not reached them because of the resources that are supposed to support them to carry out screening in those places.
Okay, so what kind of advice are you giving to people who, when they see these buses, because of the stigma that comes around with cancer, someone is like, what if I go there and they diagnose me? What kind of advice would you want to give to them? Because now this is an initiative that is being put in place so that people get to understand that they have cancer, or they don't have, to rule out that they don't have cancer. So what do you think, or what would you advise our people to be able to do in order to get to understand that screening is okay?
Yeah, actually, there's a saying in Uganda, nti ekijja
omanyi
kikola ki
kinyaga
bitono, that what comes when you know there's little damage done, like knowing that a thief is coming. You will prepare and ensure that you're able to repel that thief from doing what? Entering or causing harm to you.
Yes.
So the same thing happens if you don't carry out screening. Then by the time you reach, you'll be in a late stage, because there's breast cancer where women are supposed to at least screen. There's cervical cancer, there's prostate cancer. So people always encourage you to go and screen. But sometimes you don't take advantage of these services. Even those who are in insurance and they are covered by either the facility or the workplaces, but sometimes you don't take that opportunity of going to do general checkup or general screening of you to find out what is going on. By the time you come, it is already in an advanced stage. Because sometimes most of cancers are not painful. But when you reach a certain age, that's when you start feeling pain, discomfort, complaining of this and the other. So screening is very, very, very important, that we should always be doing every now and then.
And also there is a myth that people have in terms of screening. They think that the screening is quite painful. What are some of the things that you would want to say? Because we said there are myths and people feel like, if I go there, they are going to prick me, they are going to do this, they are going to do that. Could you educate us more a little bit about the screening process so that someone gets to know and have expectations realigned with what they may have been thinking about in that regard of screening?
Yeah, I think actually I've heard even from somebody that I went for screening, but don't think I'll go back again, because they said they feel pain. But it's like saying, since I've given birth to my first son or my daughter, I will not conceive again, because giving birth is a painful process, but still you go ahead and conceive. So much as there are those pains and what, but it's for your good, because once you're not screened, then you're at risk. So you have to go and also sometimes even our mental sometimes people come with a biased mind about screening. They say they don't want to hear the results. Okay. So there's someone I met he works in a bank, and I found out I was working at Cancer Institute. I was telling me, I've been postponing screening, but why? I told her, please, you need to come. And up to now, I've never seen her. Why? She fears, she doesn't want to know the results. Okay? But still, whether you come or you don't come, it doesn't change anything. The best thing is to come and they screen you. Okay.
Okay.
So that you know how you're standing health-wise.
Okay. You've also talked about certain committee that you people are having in regards to psycho-oncology. Mm-hmm. Could you tell us more about it? And people who, because studies are coming, and you are also talking about students are getting to enter into this field so that they can pick up on and understand that psycho-oncology is a field that they can take on. But also the community that doesn't know about this, could you educate us more about that field?
Okay, there's we now have Psycho-Oncology Association of Uganda. It is affiliated to International Psycho-Oncology Society. It is based in the US, but it's global. And we had a 1 year training for different people in different countries, including us here in Uganda. Those were Kenya, Nigeria, different Egypt. So we are taken through that training about handling the psychosocial area of patients, because it's one of the biggest issues in that patients experience a lot of distress, a lot of depression, and they have no one to turn to. So this is why this area is coming in, to ensure that we tailor the psychosocial support to cancer patients. Because if you bring someone who is counseling maybe an HIV patient, not be the same experience like the one who's counseling a cancer patient, because cancer diagnosis is like a death sentence. So once someone learns that they have cancer, it's almost like the end of the world.
They're going to die immediately.
Yes, like a turnabout. You're saying you go north and they're going either south or west.
Okay, thank you so much for that information. And in regards to government and ministry, what are some of the things that you feel like government can be in position to work hand in hand with this new effect of psycho-oncology so that we can amplify and support the mental health of our clients as well as the caregivers? What call do you have out to government in regards to this field of psycho-oncology?
Yeah, I think in the regard of psycho-oncology, I think the government has to integrate it into the health system, especially the different regional centers that we have. And if possible, even the lowest health unit, because most people come and they don't know about cancer. They come, they told me they go to different clinics and what. I wish they would even do it at the referral centers, regional centers, would have someone to do with the psycho-oncology to counsel these patients or to identify, and because it's not only cancer but even other illnesses. Where people go into a lot of mental stress, depression, anxiety, a lot of fear, but it is even worse for cancer patients. So I think the government should support the best way possible to ensure the psycho-oncology arm is fully supported and embraced, to ensure we support the patient, because there are so many patients, but there are very few people who are able to support them in that area of psycho-oncology.
Okay, as a public health practitioner or specialist, what are the things that you feel like public health should also put in mind in regards to cancer and the mental health related aspect of the cancer patients?
Thank you. I think as we take the public health fraternity, we need to arise and support serious, especially in the area of cancer. Just as we supported in the area of HIV/AIDS, we had different partners coming in, different donors coming in to support. I think it should be the same thing even for cancer, where we need to have a lot of support, because it has affected not only the people here, but even big people in government and ministers, So it's a big issue that the Ministry of Health needs to put in even more effort, especially in the area of public awareness, just as they're doing the national as a plan of ensuring have this screening. Maybe more effort should still be given in still that area to ensure people are aware.
Okay, as we are seeing that students right now are studying things, and there are some things that they're always telling us, be a lawyer, be what, and this is a field that has not been explored more. What are some of the things that you would encourage parents who have children, because we want to build up on a body of people who can support, because you've talked about the overwhelming numbers. We want to build on a body of oncologists or psycho-oncologists who can support these people. What would you want to educate more about psycho-oncology as a field, so that parents can also be able to embrace it as well as tell it to their children to be taking it on as a course to be able to do and be able to research more about it?
Yeah. I think psycho-oncology is a very key field, especially in our setting and this area, because it is common in the advanced countries, but in the low-income countries, it's something that is just coming in. So I would think it's an opportunity to encourage your child to pursue something in that area, because there are very few people in that area currently, yet something that really is important for the cancer patients and for our community outside there and for our country. So it's an area that should be embraced and explored. It is very, very important, much as it's still a virgin area where people have not explored or done so much, yet is very important in cancer care. Okay. Because just as I was saying in the previous episode, that it is just in the mind. Once the mind is defeated, then the other things may not even help, because you find someone is worried, is depressed. Because of depression, it even affects their immunity. Meaning that even any disease may start affecting them that wouldn't have affected them if their mind was strong.
That's true.
Yes.
Okay. So what are your last remarks as we are concluding on this episode today in regards to government? Like you've said, you have a call. There are some things that you've also seen happening at Uganda Cancer Institute, and you feel like if they are tackled, they will be in position to help the patients that we do care so much about in regards to their mental health. Like you've said, that the mind is as much important as other care.
Yes. As the body. So I appreciate so much the government for what they have done at cancer. There's a lot of development. There are tests that they used not to do that they are conducting right now. There are so many, there's a lot of development that the government has done in the area of cancer. But still, we still need more support from government till that area, in the area of psycho-oncology, and also having more and more health workers on board because of the overwhelming number of patients. Yes. So I think if government brings on board more health workers, I think it will be very helpful, in addition of opening up the different regional centers. Maybe if you even open up more, especially because I've seen there's north, there's west, there's maybe West Nile, Naroa, but in the east, we also need to have at least some place, a regional center where these cancer patients can, because we have patients coming from all over the country.
Okay. In my last remarks, I would want to ensure and talk to the people who are listening to us that as you are taking care of your body, because when we talking about cancer, we are only looking at the physical aspect. But remember, when you are not positive, even the medication that is being given to you, it may not be in position to work. Therefore, I call upon each and every one of you who has a patient, a client, a co-worker, someone who is affected by anything that has to do with cancer, please support them, because their mind, if it is catered for, it will affect, or even if it is catered for, it will be enabling them to be able to restore their health and be in position to be the loving people that you've always wanted them to be, the breadwinners that they have been, the colleagues that you want to look out to. So make sure that you are supporting them emotionally with restoring hope in them, with helping them to feel like they are really noticed, they are really loved, and everything is going to be in position to be, because it's a journey, and they can be in position to get back to their lives the way they want to live them. All that is what we have discussed today with Mr. Peter. And if you want to reach out to him, he will be in position to tell us where he sits at Uganda Cancer Institute, so that we can be able to reach out to him in regards to some of the things that they have discovered as in their partnership with Fred Hutch, so that we can be able to continue with the research as well as the findings that are going to help our patients in terms of their mental health as well as their physical health.
Yeah, I sit in Global Oncology Building. It is at UCI Global Oncology. It is at Uganda Cancer Institute. So that's where I sit in the research area.
Okay, thank you so much. That has been all that we have for you, and we hope that we have been able to cater to some of the needs or the asks that you've been having in regards to cancer care, as well as how it affects their mind and how we can be in position to support ourselves in terms of our mental health. Thank you for listening. Hope to see you in another episode. I have been your host, Asiat, and this is It's All Mental Podcast. See you next time. Bye.